And I see Matt taking off his socks. So what socks do you have to show us today?
Can I tell you, first time I've
Please.
worn these, and every once in a while I'll get a sock where I'm like, that is the biggest pain to get on my foot because it doesn't stretch out in the right spots. And this was one of them. I was like, this is terrible, but they're fun. These are Stitch socks.
Oh, those are so cute.
Yeah,
That's probably
lots
because
of,
they were meant for somebody shorter than you. So,
well, no, these are, well, maybe, but they were like grown man socks, but
well, there you
maybe I'm wearing kid socks. I don't
go.
know.
Yeah,
But
they're
I will
cute.
tell you, I'm gonna have one foot without a sock because putting it back on right now is
Not worth it.
chaos.
Yeah,
Yeah. So anyway, there's my fun Stitch socks. Okay.
they're fun. And what is
Uh,
your topic for today? What are we going to talk about?
well, so that's a great question. I have been thinking that I was gonna dive into, it's something we've talked about before, but I'm gonna frame it maybe a little different. I want to talk about confirmation bias
Oh,
as,
great one. Yes,
as
thank
it
you.
relates to the coupleship. And to give you guys just a very brief Matt version of confirmation bias is that essentially we look for what we're looking for, essentially. And when we are trying to find something, we will find the evidence that supports it. And this shows up in so many different ways in our lives. Um, if you're I don't know, people have told me like if they're shopping for a new car, they suddenly start seeing that car everywhere on the road, or if they buy a car, then they end up seeing that car everywhere, but they weren't seeing it before, right? Like we essentially, our brains really look for what we're looking for, and where this is, it can be a good thing and a bad thing, depending on what's going on. And so, one example is if, for instance, um, let's say we're struggling with compulsive behaviors and we aren't owning it very well in our own lives, then we look for the excuses in our partner for why this isn't my fault, right? If my partner was wanted to be more sexual, if my partner was friendlier to me, kinder to me, if my partner was, appreciated me, then I wouldn't struggle so much with these things. Or if a partner has a disclosure, for instance, and their world comes crashing down, which is horrible, then it's like they're looking for all the evidence of, that uh, my partner isn't making changes or doesn't care about me or doesn't love me. Now, we don't need um, negative things to happen for any one of us to have confirmation bias. We just need a life history. If I have a history of not feeling like I can trust people, then anytime I'm hanging out with people, I'm subtly looking for the evidence that would support that I can't trust them. And I have to start to own that this is my bias. Now, in the world of couples therapy, I often talk about this as I have to own that this is my judgment. I have to own that this is my fear. So even better when we start getting down into the emotions of it, look, I'm scared that you as my partner aren't wanting to actually change. I'm scared that the only reason you're making changes right now is because you were caught. I'm scared that you are lying to me because you've told so many lies in the past. And although sometimes, and maybe even often, our confirmation bias could be true, um, we have to leave room to have other possibilities. And that's really difficult for somebody who's in pain or somebody who's scared or hurt or lonely. It's really difficult to create room for something other than the judgment they already have. Now, you guys have heard me and other people talk about using gracious assumptions, right? And so a lot of the things we're trying to do is figure out what's the most gracious light that I can put on your behavior, even if it's lying to me. There's nothing okay about lying to me. There's nothing that makes it all right. There's no excuses. However, you were scared that I'd be mad and you didn't want to lose me, and so you lied to me. I can have a gracious assumption for your behavior instead of you are lying to me because you are a compulsive liar and you're never going to get any better and you hate me, right? Again, if we're going to try and heal a relationship, we need to spend time understanding that the judgments, the confirmation bias, and start opening up room for there to be other possibilities. One thing that I would recommend that people do is actually keep a judgment journal where you
Mm.
start writing down the different judgments you have and see if you can start to notice how often you judge. Now, I tell people that our brains were wired to make judgments. It is not meant, our brains do not have the capacity to not make judgments. When we're out driving our cars, if we're like, oh, interesting, the light just changed and it looks like that other car is coming, let me think this through. That you're gonna die, right? You don't make a judgment. I mean, you make a judgment split second, you slam on your brakes, you come to a stop, you realize, okay, we're safe, right? And then you go, oh, crud, I guess they weren't turning like I thought, you know? Oh, good, we avoided an accident, right? Our brains are wired to make snap judgments, and we do that to keep us alive. We don't have time to sit and think, huh, you know, that dinosaur might be hungry. Um, right? And so it's important that we make judgments. I don't think, though, that many of us realize how many judgments we're making all the time, even about our partner, about our friends, about any relationships we have. And so creating a judgment journal where we can start to write down, you know, the look that my friend gave me makes me wonder if they were annoyed with me. So then, um, I'm like, oh, I'm making a judgment, and my judgment is that they're annoyed with me. Okay, now what am I going to do with that? Sometimes I might confront my friend and say, "Hey, when we were talking the other day, you seemed really annoyed. Is everything okay?" You know, where we open up a conversation. Sometimes we notice, huh, maybe they weren't. Maybe, and we don't even confront them about it. We just think, you know what? Maybe they were tired, maybe whatever, but I'm not going to use that judgment against them. And so you create a judgment journal just to start gaining awareness of all the different judgments you have. But then you could also then, you know, keep a line or two between each judgment and write, what's a gracious assumption that I could take that might be beneficial for this person, for me personally, and start trying to write down some of the gracious assumptions to see if I can start shifting those judgments so that those judgments don't build up and become resentments, hurts, whatever else. So there's just a few quick ideas. We can talk more about confirmation bias, judgments, but just a couple of things. Any
Yeah,
thoughts?
so yeah, I do because you said you have to leave room, and I was thinking, oh, that's got to be so hard to think about because it's like if I leave room, that's leaving room for the unsafety and all of the, like I need to be safe, that whole
Hmm.
aspect of, if I'm making a gracious assumption, like even the example you were using with like, there's a lie, well, and yes, it could be for a multitude of reasons, and if it's somebody who's on a recovery path and they're working on it, then yes, hopefully they're just going like, oh, I'm still scared enough that I'm not going to do this, but um but it's really challenging to move to that space because like you said, our brains go to danger, danger,
Oh
danger,
yeah.
and just pulling in pulling everything in, oh, now I'm going to be okay, versus the, oh, if I look at this stuff and I start looking at, into those spaces, what's going to happen?
Yeah, and I struggle with this because I want to affirm to every hurt partner out there, it makes sense why you don't want to leave room for gracious assumptions, because it in a way it protects you from pain, but again, it also blocks you from connection. And so there's this delicate balance of how much do I protect myself? Because the more I protect myself, the more I block myself from that healthy connection rebuilding. and and I can't tell people what level of trust they need to put in there. But if you don't learn to get uncomfortable with that scary place of more pain possibly happening, you'll never rebuild a relationship.
So let's talk about, because we're kind of, talking about a betrayed partner having a judgment. Let's talk about the addict partner having, because I think of how
Well,
much judgment there is and how
oh,
much
I started.
defensiveness and everything
Oh,
else.
well, it's funny because I actually started my examples with like
Oh,
an addict. No, you're cool. You're good.
okay.
But no, because to be honest, I will tell you, as I've worked with both people over the years, what I've found is that there are probably more buried judgments on the part of somebody with an addiction than there are a betrayed partner, because they've spent all these years burying their needs, their wants, desires, their whatever issues, and they've create these belief systems around what's made it okay for them to do what they did, right? And so the individual struggling with addiction usually has way more judgments, and I don't know how that's measurable, really. I don't, maybe it's not way more, but it takes me as a clinician longer to go in there and start digging those out. And so I'll give you a really basic one that I'm sure many of you have heard, especially if your partner's struggling with sexual compulsivity, is it's like, "Oh, well, my spouse hates sex." And
Oh,
and that's a judgment I hear all the time, and I'm like, "No. What if your spouse I have to be careful how rudely I might say this. But how about this? I'll say it this way. Um, it is not, so it's Patty Klein who I think said this. It is not dysfunctional to not want sex that you do not like. And so if I were to say, "Oh, well, my spouse hates sex," and my question is, "Well, what if the kind of sex you're offering isn't enjoyable?" And it's not like, we're not talking like positions and techniques, although that might be part of it. We're talking like, typically for a person, sex is enjoyable when it's a full emotional, not just a physical body, but an emotional body experience. Well, are you offering an emotional body experience in addition to a physical body experience? Because if you're not, then the truth is she doesn't like the sex you've offered all these years, or he or she doesn't, right? Like, and so that's a judgment that, rather than, "Hey, why don't we figure out what kind of sex you like?" Now, keep in mind, a lot of times it's like, "Can we hurry and do that so I can have more sex?" And it's like, no, that's not what we're doing. It's not about getting you more sex faster. It's about actually making the sexual experience good for both of you. And so that's a judgment I see all the time, that I'm like, we need to slow that down, because do you even know the type of sex you like? I've had so many partners that are like, "I got into the marriage, I knew my partner had a sexual history and maybe looked at porn, and so I felt sexually inadequate." And yet I sit there and go, "Yeah, but what kind of an education is that?" Right? A good likelihood they don't even know the type of sex they enjoy. And sometimes that is part of what the compulsivity is about. It's this uh, insatiable desire for something sexually, and they've never even learned how to have a healthy sexual relationship. And so we have to do a lot of work around that. But that would be a great example where the partner with the addiction is creating all sorts of judgments, and there's plenty more. So did that answer that, Tammy?
yeah, yeah. And I'm going, okay, so the gracious assumption is, like we should have a discussion about this, and maybe with your qualified therapist, if this is one of those
Yeah.
subjects you're going like, I don't know what to do, I don't know what to say.
Well,
Or she might
and
say, no, I don't like sex with you. So,
right. And this is one of the hardest things I've actually found over the years. that like the two things that take the longest to get to in therapy is often sexual wounds and religious wounds
Mm,
or spirituality, right? Like those two things, for whatever reason, seem to take the longest. And I swear I can often get to sex before I can get to a lot of the spirituality stuff for people because I think it's just so deeply personal.
yeah.
But yes, a qualified therapist, and that's the other thing. A lot of therapists, they're not sure how to address sexual things. And if your therapist isn't sure, it often leaves you feeling uncomfortable to go into that realm. So, yes.
Dr. Rob often talks about with therapists, the two topics that a lot of therapists do not want to talk about are sex and money. And
Yeah.
and in this arena you've got to be willing to talk about all of those
Oh,
things,
gosh, yes.
but I hear you with the spiritual aspect or the spiritual core beliefs, and especially because those are usually from a very young age, and not just family but community, as well. So there's a whole dynamic of that, so I can understand why those would be deeper. And we had a work group on spiritual woundedness, and unfortunately that was a hard one to fill. People, but we have a lot of guys that come to our
Oh,
residential
interesting.
treatment program that they do the work while they're there, because that is such a key thing,
Hmm.
and holding the space. And from another standpoint, with, if this is my belief system and I've been acting out over this way, there's the misalignment, and more, shame and guilt and everything else around that.
Hmm.
So yeah, like this is why this is complicated work, and we really want you to have the right people to help you, because going to the therapists that are not trained for this, like you can imagine, and you probably, maybe some of you have experienced how it's not only not helpful, but can be hurtful on this, on this journey as well. So um yeah, like, so what I'm hearing too is, like, if with a couple, it'd be fascinating for each of you to have your judgment journal,
Hmm.
and then to see how those judgments are coming up for each of you. And if you have the ability to talk through with the help of a qualified professional, great, but be
Totally.
able to talk through and go, I have this, this is my bias, tell me about yours, and to be able to talk through that would be, I mean, really, when you're talking about all of this stuff, it's intimacy is the being able to be vulnerable, terrifying as it could be, but to be vulnerable, and really know someone.
Yep. It is a terrifying thing, and I do agree. Like we have to, the more we can start owning our judgments with each other as a couple, and keep in mind, if I own my judgment, you shouldn't then grab my ownership and beat me with it, right? Like
Correct.
if we can both own our judgments and slow down and just be present with each other in the recognition that we're both starting to see our judgments, we can really shift things in the relationship because even though maybe that judgment hasn't changed, at least now I'm starting the ownership process and I can start to check it in, I can start to explore. The more I own it and the more I can start to see that, the more that there's room for both of us to have growth there. So,
Well, and I was thinking too, it's like, okay, if we're willing to do that, like we're we're on this journey together, and we're willing to do the hard stuff, because this is the stuff, that is scary, but wow, this is the stuff that really shifts the whole, the whole dynamic and the whole relationship, where we're not, in our heads and wondering what's happening and all that. We're able to, connect in a real and meaningful way. So okay, so uh okay, we've got some questions, and I pulled up the questions from last month too, or earlier, whatever. I don't remember if we did all those.
no, so that's the funny thing. I think we had pulled up the questions from, it would be 2 sessions ago.
Yeah,
And then we're like, but let's start with the fresh ones. And then we
yes.
never got to them. So it's totally
We're
up
going
to
to do
you.
the same thing now because there's
Okay.
only a handful, but yes, you guys are here, so we're going to start with these. So this person attended our residential treatment program, and my wife was very supportive, and also the first month out of SILA. Now, with a formal disclosure approaching, she says she doesn't know who I was and says the addiction is BS. I was just an asshole who did what I wanted to do and who did what I wanted to do. How do I show her that I am an addict?
Okay, so
hear a lot of fear on this. So
oh, totally.
yeah,
Here's what's interesting. Don't show her that you're an addict. What I hear her hearing, I hope that makes sense.
yeah.
What I hear her hearing is that she's hearing that the diagnosis of addict is being used as an excuse. And so what you want to do here is double down on the way you treated her and how it impacted her. So you're going to own, I was an asshole. I did do a lot of things in my addiction that was terrible. Nobody should treat their spouse the way I treated you. So whether or not you want to agree with my diagnosis or not, the truth is, whether I'm an addict or not, you didn't deserve to be treated the way you were treated. So don't make this about you and your addiction. I actually think that's what she's saying. You're making all this about being about you and your addiction, and what you need to do is lean into the hurt and pain that she experienced. And every time she's like, "You're not an addict," or whatever, right? You just need to lean back into, well, it doesn't matter what label we put on it. I didn't treat you the way you deserve to be treated. And I'm trying to learn that now, and it's going to take me time. And the truth is my unhealthy ways are probably going to come out, and I'm going to need to apologize, and I'm going to need to make corrective changes. And I hope you're patient with me while I do it. So that if I'm you, that's where I'm leaning in. And she is essentially saying you're not an addict because this would be my guess. She doesn't want it being used as an excuse for behavior that was painful. It's almost like it's dismissing her pain by putting a label or a diagnosis, and you just need to lean into her pain because that's what she's crying out for. So I hope that's helpful. Please ask more questions if you need me to elaborate on that. But that to me is what I'm cluing into right away when you wrote this question.
And I often say addiction is a reason, not an excuse. And if we're constantly going, well, I'm an addict, like it is very dismissive to other people. It's like I'm an addict, so I have to work extra hard to, to shift and change my behavior. So this is an opportunity. Lean into all of your aftercare work, all of your recovery work. Double up on that if you need to. But yes, taking ownership of yes, my behaviors, hurtful, painful, horrible, whatever. And that's why I want to do this formal disclosure so that we can start with a foundation, on which to build. Ultimately, you've got no control over, we say this to partners all the time too. You've got no control over, what that person does or doesn't do. Same with you, but you starting to show up. I'm with Matt. It feels like she's trying to push and see if you're going to go right back to the same things, or maybe you already are showing up, with some of that addict attitude, so learning to be a different person, you can do it. You've got some skills, you got some tools, and you've got a lot of support. So lean into those things. The next one, I'm scared that I'm falling out of love with my SA husband. We've been separated and no contact for 2 months with 4 more months to go. With no contact? Oh wow. I don't think he's in true recovery yet. Maybe he's still in active addiction. I don't know what to do to keep the attachment. I feel like I'm in the dark waiting for him, even though I'm in recovery doing your workshops and courses. Should I request joint therapy during this time? I'm so conflicted. Thanks for all you do.
Okay, so I'll
Thank
jump
you.
in.
Please.
So first of all, I'm going to add a disclaimer. Um, if you're in an abusive situation with domestic violence or any other type of abuse, and you're in some sort of a trauma bond cycle of abuse that requires separation with no contact, then keep doing exactly what you're doing because you may need that space in order to get out of an abusive situation. Um, and that 6 months might be exactly what you need in order to essentially stay away from the abuse and maybe divorce and move on with your life, whatever that's looking like. But other than abuse, there is a part of me that is uh, wondering, and you don't need to answer, but I am questioning why you're doing 6 months of no contact. So now, you, like I said, you don't need to respond to me. You don't need to justify it. I'll let you sort that out, hopefully with you and your therapist. And so if that's the best move here, I will tell you though, that if I didn't have contact with my partner for 2 months, as much as I love her, I would probably have feelings like I'm falling out of love as well. I mean, it's like saying, I haven't watered the grass for 2 months. Why is it dying? And so you've got 4 months to go. 6 months of no contact, you're going to disconnect. That's actually what you're doing. You're disconnecting from each other for 6 months and having no contact. So falling out of love makes perfect sense. It just like, if you will, the way we fall in love is by spending time together and connecting and watering the grass, right? I don't know if you've heard that cliche term, the grass grows where you water it. So it's like, just looking at that situation, I'm like, of course you feel that way. How do you keep the attachment? Well, if you're going to try and keep the attachment with no contact for 6 months, you would probably need to, look back on old communication that you guys have had and read through old emails and write down stories of good memories that you guys have had and, like go through your history and retell the stories to somebody about how in love you guys were. I mean, the only way you're going to keep attachment is by finding some way to nurture that within yourself if you're not going to have contact with him. And so it is a little bit perplexing because I don't know your circumstance, and so I'm not going to give you specific advice, but in the sense that um falling out of love, you're going to with that much disconnection. So should you do what'd you say, conjoint therapy or joint therapy? Well, I don't know the direction of which you've been given to do this 6 month no contact separation. So I really can't answer whether or not you should do joint therapy. And then the idea that you don't think he's in true recovery, maybe he's in active addiction. Well, certainly that's possible. My hope is while you guys aren't in contact, that he's doing a bunch of his own work and that he's working with his own therapist and taking the courses and the workshops and that sort of thing. But so it's a little bit interesting because I could make all sorts of comments, but I wouldn't want you to take them as advice if you're doing this for lots of reasons I don't understand. So I don't know, Tammy, did I answer that okay?
I have I have a resource for you. Last week, Dr. Stevie Hall and Lindsay Stanley, who wrote a workbook on therapeutic separation, hallelujah, we needed that. Were a guest on a webinar. So I put the link in the chat. But if you're watching this later, it's on the Seeking Integrity under our previously recorded webinars, which this one will be too. So if you found this one, you can find that one. But they talk about how to have this, and there's a workbook for each of you to do, and it would identify contact or how to have contact. My question is, and I'm perplexed too, and again, we don't know any of the details, but I was like, and so after 6 months, then you're magically supposed to come back together again with you, like it's almost like you don't even know what's going on. So that would be like, I would be wondering about that. But that workbook could be really helpful for the two of you and your therapist. They are doing trainings with therapists on that now, which I love. I even asked them, I said, outside the world of addiction or sex addiction, there just isn't good information. So when somebody's looking to separate, people just separate, and so this is with a plan, and this I think can be really useful for you. But I would really want to know what the rest of the plan is. What does it look like when you do start having contact? How is that, and what is the is it, do you ramp up for the next 6 months? I don't know any of those details, but that would be interesting to know, what how what benchmarks are, is your addict partner, giving their therapist that? Is there any kind of, not report card, so to speak, but a checklist? So you're going like, oh, I see that, they are, doing some recovery work, etc. So I don't blame you for though being kind of like feeling you're completely, in the dark about all this stuff. So
Oh, for sure.
what about the sex addict who won't initiate or have sex with his wife? Basically, the sex he has is with himself.
Great question. I will tell you, because of the many years I had been working in the sex addiction field, one of the reasons I actually started studying sexual health was because this was such a common occurrence that even if, so let's say you could get an addict to stop the compulsive behavior, having them learn how to do healthy sex was well, at the time felt really difficult. And so one of the things that I've been studying for the last several years is sexual health as a way of, instead of, you have this overactive sexual behavior, and then what often happens is a swing to sexual avoidance, or as Carnes talks about, as he calls it, sexual anorexia, but sexual avoidance is really what it is, where so what ultimately needs to happen is he needs to be exploring what his sexual avoidance is about, because instead of engaging sexually with a partner who it sounds like is willing, right, he's just choosing sex on his own, and which is depriving the relationship of and the opportunity for attachment and connection and everything else. So it's tough. Like, I know that there's not a lot of CSATs who are trained in the sexual health world. Alex Katahakis is a good one, who she has some different work out there that's CSAT and sexual health related. But you guys probably need to start exploring what that sexual avoidance is about, and ways of um, working with that and getting past those barriers. But if possible, find a sexual health therapist who, if possible, is also a CSAT. I was actually, Tammy referred somebody to me the other day who happened to tell me that he was studying sexual health just like me. And I was like, oh my gosh, like, and there's not very many of us. So, but there are some out there. But I don't
I
even
actually do know. Yeah, like yeah, I actually know a bunch. So
know. Oh,
I
do
mean,
you
there's
know a bunch?
I know more than you'd be surprised. Well, Dr. Roberts
Probably.
too, but yeah, but like no, there are becoming more, and I really appreciate that when it gets into this. But with this, I'm going like, why is he having sex with himself if he's a sex addict? Masturbation is, I don't know.
Well,
I
so
don't know why
that's
masturbation is in the inner circle behavior.
Well, so that's where like each individual and the couple ultimately have to figure out, right? Like, because the reality of it is if he can't engage sexually with his wife, then we do need to have a conversation. Well, does masturbation need to be in the inner circle? And really, that conversation is something he's got to be figuring out, because I don't think that the partner should be dictating what is in his inner circle, if that makes sense, but definitely be having a conversation as a couple. Because if you're sitting there saying, hey, I would like to start engaging in a healthy sexual relationship, and he's like, no, I'm on my own, then we do have to look and go, is that in the realm of is that in the realm of healthy? Is that just aiding in the avoidance and in a lack of healing? So no, Tammy, you're absolutely right that it definitely needs to be explored and talked about. But I don't know that masturbation is off the table for every individual in
It
recovery.
isn't, but for somebody where it's problematic within a relationship, and even
Yeah.
for a period of time, and then back, like if it comes back with discussion with the therapist, was discussing with the sponsor, having like there it's way more complex than I'm just going to go over here because I'm used to doing this and it's easy, and then I don't have to I don't have to worry about, I don't have to worry about my partner, so it feels like a lot of avoidance and an unhappy partner. So the challenge is, for those of us in recovery, if we want our relationships to be good, we have to do the uncomfortable things and have the conversation of like, yeah, it's really easy for me to do this, and it's, the same numbing out, escaping, all of those things. It takes me to a different place versus I want to be connected in a real and meaningful way with my partner. So it would be fantastic information for the two of you to discuss with your qualified professional. And if you don't have one, TAMI at seekingintegrity.com and tell me where you're located. I'll do my best. Okay. We're doing 6 months no contact based on our therapist advice since he's actively hurting me with his fantasies with everyone we know.
Okay,
Okay.
so that was from the
That's
earlier
yes,
question.
yes,
And
thank
so
you. The
so
fantasies with everyone we know.
yeah, and so I would say on this one, honestly, follow your therapist's advice. Like, it's a bit unconventional, I would say, but at the same time, I would never recommend going against what your therapist is actively working with you with. But then just make sure your therapist is aware that hey, I'm falling out of love, and like if that's the case, that actually might, in some sense, might be what you need in order to be able to see the relationship clearly, and before you make a decision. But again, I can't speak to it. I'm not your therapist, and I would say follow your therapist's advice.
And I'm going to pull up because I have like, a zillion things. The should I stay or should I go? And I share this often. It was a series of four webinars. But the one with Kristen Snowden at the beginning of the series was the 10 questions. Is Dr. John Gottman. The questions came out of his work, which they're great at relationship stuff. So um, and you may get a read on, how do I really feel about this person, particularly now that I'm not in the thick of things. And I can imagine how hurtful it is for you to be thinking every single person he's having some fantasy about, or maybe knowing that he's having that, so that may be something that, it would be really important for you to consider. So thank you for clarifying that, though. That puts some context to it. So okay. Betrayed partner here, 4 years post discovery, working to rebuild the marriage. My partner is ASD level 1 and ADHD. When he's overwhelmed, he goes nonverbal and shuts down for hours and days before being regulated to work on repair. What are tools that can be used to still communicate the need for space and self care? Can anti anxiety meds help with the severe sensory sensitivities and baseline high level of anxiety? I have before I'm going to turn it over to Matt. I'm going to go pull the information. Candace Christensen, who is the expert on these co-occurring, she did a webinar with us, but I'm going to pull her information. It might be really useful to have she does consultations with people all over. It may be really useful for a consultation with her directly. So I'm going to go pull those pieces of information, and she's coming back. She was going to do a webinar last week and she was really sick, so she wasn't able to. So we've got it
Yeah,
rescheduled.
Candace.
She'll be coming back. So, but
Yeah,
she's good.
Candace is known as I think she's up in Salt Lake, and she's known as one of the experts on ASD and sex addiction, that sort of thing. So definitely check out her information. So first of all, I can't really speak to medication, but I will say that is it possible? Sure. Like I would consult with a psychiatrist about that. But I don't know that most of the time we don't use medication to treat um, ASD, right? So autism spectrum disorder. You're not using medication to treat it, but if if the individual has anxiety and that's able to be regulated with medication, then sure, why not? But you're not actually treating the ASD. So I would talk to a psychiatrist about that to see if that would be helpful. And then, I mean, there's different books out there. ADHD and Marriage is often a really good one. Um, and I'm trying to think. There are some other books out there specifically. I think usually you have to go look for like Asperger's and marriage, even though Asperger's isn't a diagnosis anymore. But a lot of the books, and I would just try to study up and practice tools that way, besides seeking a therapist specifically that could help the two of you work through that. Um, but don't give up. I've worked with plenty of couples. It's not uncommon for me to be working with a couple and say, "Hey, I want to throw out an idea that you could be on the spectrum." And I've had people go get testing and come back, and sure enough, they're ASD level 1. And I've had other times where they come back and it's something different and it's not ASD, and it caught me off guard, and that's fine. But there are times where things like that are happening, and it does create a bit of a dilemma for us to work through. But yes, there are tools, and sometimes it's also accepting that the dynamics of the relationship can just be different, and that's not always easy. So I don't know that I gave you an amazing answer, but hang in there and check out Candace Christensen's stuff.
Yes, I put it in the chat and I was looking for when she rescheduled and I didn't find it yet. So I'll keep looking for that. So but getting like we keep talking about getting the right help makes a difference. So okay, my partner is coming up on 2 years of sobriety and I'm so proud of him. I'm also scared or am I nervous he will relapse because he's so confident he will never relapse. He goes to meetings and is about to start the steps. Oh gosh, he's just starting the steps. Okay. He keeps telling me I have no reason to worry. Am I crazy to worry? Is the confidence healthy? And why is the confidence intimidating me and make me feel nervous? As a person, I'm going to share this. As an addict in recovery, I have decades and I never say, I won't say I'll never act out again. Like I won't. I went to a 12-step meeting last night and he's just starting the steps at 2 years of sobriety.
Okay.
So
No, and
that's
I
my,
no, and I love it, and I appreciate where you're coming from. Here's an interesting thing.
okay.
I'll start with your question. Am I crazy to worry? Well, I think understanding the risks are important, right? Like, there's always going to be a risk that anybody who has this habitual behavior could easily, without, if they, especially if they let their guard down, right, could easily revert back to old unhealthy behavior, right? And that's really what Tammy is saying. Like, if I
Yes. Thank you.
don't remain humble and use my tools and go to my meetings and do the things that I know work for me, it's really easy for me to fall back into unhealthy behavior. And so, are you crazy to worry? No. I mean, a certain level of concern is actually healthy, right? Is the confidence healthy? It depends. A certain amount of confidence is really healthy. But when it moves over into arrogance, that's where I get nervous, right? And so the confidence is intimidating and making you feel nervous because you're worried that that he will let his guard down. I think you said he. Yeah. He's gonna let his guard down and slip. That's where I see it happen. It's mostly people letting their guard down, and then, a few habits get lax, and then next thing you know, it's like, oh my gosh, I had a slip. And at the same time, I've worked with plenty of people who um, they said once discovery happened, they never slipped again. In fact, I've had people tell me I've never tempted. Now, sometimes I've done some work with this person and come back and said, there is, even though you had a lot of really unhealthy behavior, we might need, there might be some evidence that you truly weren't an addict. You just had a lot of really unhealthy, compulsive behavior that didn't reach the level of addiction. And now I would say that telling somebody, don't let your guard down. Use all the tools you've learned, keep using them, and live a healthy life. Because whether we label somebody as an addict or not, we're dealing with um, a similar issue, and that is unhealthy behavior that causes pain in their lives and in the lives of those that they love. Um, so there's a part of me that says, "Hey, that's great. He's got 2 years of sobriety, and you're proud of him." And what I would be doing if I were you is say, "Hey, I want you to have confidence, but can you talk to me about um, how you're able to keep your confidence but stay in a healthy place of guardedness. I don't normally use that word, but in this, I think it applies, right? A healthy guardedness from slipping back into your behavior. So, can you show me your confidence while also teaching me how you stay healthily guarded from these behaviors? And I would have more conversations about that. Because if all you're hearing is, no, you have no reason to worry, everything's fine, there's no problem, and you're not hearing, hey, I don't want you to worry. Here's what I'm doing. This has really made a difference in my life. I'm gonna keep doing this. Like, as dumb as it sounds, if my wife were like, hey, you stopped riding your bike, are you okay? And I'm gonna be like, no, I'm not okay. Right? Like, there's certain behaviors if I stopped doing, like, they should be clues, and my wife is gonna be like, you all right? And I've had that where my wife's like, you haven't been on your bike in a week. Is there a problem? And I'm like, yeah, we need to talk, like, and it's that same type of thing. Confidence is often there because of the rituals and the behaviors that we're able to keep up. And and so I want you to be proud of him. I want you to be excited. I just have a lot more conversation around how he feels he can keep that confidence and it not be arrogance. So, Tammy, anything else you want to add, or was that okay?
I'm going to be very careful because, yeah, because I just, it's not even, it's the behaviors, but it's the thinking,
No,
like, yeah, like all of this starts with denial, like, oh, I'm doing really good. I don't need to go to my 12-step meeting. Oh, I'm doing really good. I don't need to talk to my recovery friends. Oh, I'm doing really good. I can go, I
yep.
can go to that, bar by the
I
strip club. What, like, that's the problem, with addiction is it's so insidious. And so that's the scary part to me when somebody else says,
yeah,
"Oh, I got this."
and
So,
I would agree with you. Every individual that I've ever seen have a problem, now that if I'm trying to think about it like objectively, nearly all of them, it'll start with some stretch where they've done really well, and then what they do is relax their behavior. And so, I think Tammy and I absolutely agree. But I am trying to leave room for multiple
he's
possibilities.
making gracious
I
assumptions.
am. I'm making some gracious assumptions.
Yeah.
And could I tell you that could be dangerous for this person's recovery? It totally could, except as a partner that you've been hurt, you worrying about it more is just
Yeah.
probably going to give you heart disease. Like,
Yeah. Yeah.
like,
Worrying for a partner it doesn't get, I always say it's like, rocking in a rocking chair, it keeps you busy, but it doesn't get you anywhere, so worrying doesn't help, and worrying is distracting and hurtful for you. So I just keep going back to what are the actions showing you? Words, our lips moving, even at 2 years, but it's what are our actions showing you that shows you that there's change. And then when there's a shift and you start going, don't believe the words of, oh yeah, I got this. It's just, what, no, it's like, pay attention to that. And that's how you, regardless of what he does or doesn't do, I hope he's on a, solid path and, does not act out. Recovery is more than just not acting out. That's just abstinence. So recovery is I'm integrating all of the tools of recovery into all areas of my life, so I hope, and enjoy, but also, but hold a little space so that you're taking care of you. I like every addict, if he is, and I hear what Matt's saying, it could have just been a blip, of things. But if for those of us who are addicts, we will always have, addiction sitting there, lots of meetings we talk about is sitting there doing push-ups, whatever. But you know what? Our recovery can do, way more than that. So if we're doing the things that we need to do, I don't worry about acting out on any given day. I just don't make any promises, for the forever. So yeah. Okay. Does porn-induced ED go away with recovery?
um, it's funny. I saw this one earlier and was thinking about it for a second. Um, I would say the short answer is it can. Absolutely, it can. It depends, right? So, it takes a deep dive into understanding the sexual self. Um, and but I mean the reality of it is it's like any sexual health issue, right? A lot of times you've got to figure out what is causing this, and then what behaviors and what changes do we need to make to change it. And um, but I would say in general, as long as the couple are working on it, it totally is healable. But it does take a lot of times it can be fear, pressure, um, a lack of um, stimuli, and so you really have to, if you go into recovery and you are sober from porn, and then you start working slowly with changing the sexual interaction, then you can build up a sensitivity and an arousal around a new experience, or what might be considered a more typical experience. And so I do think, yeah, it can absolutely go away, but I don't know that I would say it would go away. It'll go away for anybody with just regular recovery. I think, it's just not going to be a natural function of, oh, I've been going to my 12 step and my porn-induced ED has been reducing. It's like you're probably going to need to do some emotional work around that, as well as some physical work around that. So in one sense, I want to give you hope and say, yes, it can go away. But in another sense, I want to say it's going to go away with um, an intentional effort.
And we often say, get a medical, consult too on, because sometimes there's other underlying medical, issues going on too. So do holistic, emotional, physical, care. Yes, stopping the porn would be a really good starting point. So, how common is it for an addict to marry an addict? Oh, or a wife to develop an addiction in response to her husband's addiction due to the loneliness of the marriage? That's an interesting question.
Oh, it's such an interesting question. And just to make it really clear, I don't have the data, right?
Yeah,
So
I
I
was gonna
think,
say, I don't know if anybody's ever
yeah.
done a study on that.
Well, yeah, and if I were to propose um, some sort of a hypothesis, right? I would actually say it's probably really common. Um, but what's interesting is because I actually, I saw this question earlier, read it real quick, and my thought was, in all of the couples that I've seen, in some sense, I'm like, well, I don't know that it's super common, but at the same time, there's probably a lot of people who never get into recovery because they're both addicts. And a lot of times, if you're both addicts, what's your motivation for getting into
Mm-hmm.
recovery? Right? Unfortunately, getting into recovery, um, is often disclosure and exposure, and you're, and in essence, a partner is like, I can't live like this anymore. And so then it happens. But let's say somebody's a sex addict and then their spouse is coping through alcohol addiction, who's motivating who to change? And so I don't know that a therapist would even be the best person to ask that question, because a therapist is seeing people who are motivated to change. But over the years, I can think of lots of couples where, we're working on one of their compulsive sexual issue and then the other one with a substance issue or something of that nature. It's common enough that it doesn't surprise me. But at the same time, it does take a unique couple where they're both struggling and yet they're both fighting for recovery. And so, it's great. It's awesome to see. I always love it. But, I don't know that I see it a ton in my office, just because unless they have little kids and they're both like, you know what, we can't live this life for our, for the kids' sake, that sort of thing. What's motivating them into recovery? can be a difficult thing, right? What motivates any of us to do recovery oftentimes is the catalyst for whether we do it or not. And I've seen it's interesting to me how many guys I've worked with, specifically men, who were like, "Oh yeah, I'm going to do recovery no matter what." And I will ask the question, if your wife divorced you today, would you do recovery? And it's fascinating how many were like, "Oh yeah, no, absolutely." And yet 6 months later, their wife divorces them and they're like, you know what, I'm done for now. And I'm like, well, that sucks. Like, here you were so convinced. So that motivation for change is pretty tough. And to be honest, with the pain that I've seen couples go through, I have a lot of compassion for why a wife would develop an addiction as a result in response to the loneliness in the marriage. Like, I would say everybody be careful. It's way too easy to pick up some sort of a habit or behavior. I mean, I think Tammy knows this, but I won't ever drink, and I never have because I know it runs in my family, and I know I'd be an addict. I am not. And so, could I see myself developing an addiction if something horrible happened and I went that direction? Absolutely. It's in my bones.
And I was thinking about this, and I was thinking, I have seen a number of betrayed partners who struggle with food, alcohol, cannabis. Cannabis is huge again right now. Not again,
Oh,
but
the
because
the
it, yeah,
ease
because
of the ease of getting cannabis, right? Absolutely, yeah.
yeah, and and I get it. It's soothing, it's numbing, it's whatever. And then at some point, I've seen partners go, I've got to get healthy. I'm going to take care of me. So regardless of what the sex addict, porn addict is doing or not doing, so that can sometimes be the motivation, but you're right. It's got to be like, I'm doing this for me,
Right.
is ultimately, if it doesn't get there for the addict, it doesn't change. So,
Yeah. So I don't, this last question says recovery of the relationship or sobriety from the addiction. Do you know what that was in response to?
um, I do not, and I'm sorry.
So
So
if they
yeah,
want to type real quick, I can
yeah.
answer. I don't know what you mean, recovery of the relationship or sobriety from the addiction, but um,
When I was talking about a recovery from like I did a webinar because I kept hearing, what does real recovery look like? And I was like, I
oh,
did a whole webinar on what real recovery looks like, because recovery takes 2 to 5 years, of doing
oh,
real recovery. So I always say
yeah.
abstinence is just not acting out. Sobriety is I'm starting to get a clue.
So
Recovery is integrated. So
yeah, so when I think this is a response to when I said I've asked many people in recovery, like, would you, if your spouse left you today, would you end your relationship or would you end your recovery? And I meant recovery from the addiction. And but no, I don't blame you. I think people who are in recovery, even if you've been the one who has done the betraying, you have to honestly consider if you are should stay in the relationship. I think it's really healthy for every person in every relationship to ask themselves, why am I staying? But I love the idea that you're questioning, should I stay in recovery of my relationship? I'll stay in recovery of my sobriety, right? But should I stay in the recovery of my relationship? It's a great question. Not an easy one to answer.
And that's why the should I stay or should I go check out the first one. There's four of them, but go check out the first one and
Does that
journal
talk
about those
about
questions.
does
So
that
yeah,
talk
Kristen
about
Snowden talks about ten questions, and it's like, do I like this person? Do I want to
but
be like all of those things? So
it's not just geared towards a betrayed partner, it's geared towards the
no,
as well.
I say both of you should do it.
Cool.
Because
Lovely.
then you're going like and compare the answers and go, yeah, I really like this person. I really like this person. Okay. So here's our common ground. Here's our, like I recommend it for everybody, because I was
That's
like,
cool.
I think even beyond addicts, like anybody who's struggling in a relationship, go, am I in or am I out? So yeah. And we have to go because I have to get out the door. I've always thought that the addict has the spouse both have an intimacy disorder, and that's why they found each other. Is that correct?
Oh gosh. So bring this up in the next webinar. Um, it would be way too simple for me to say, yes, that's correct. I don't always think that that's the case. Is it possible? Sure, but it would be way too generalized for me to answer that in such a quick like
Yeah,
close. And
that's a
so,
great topic to bring up. So
yeah, maybe I should write that one down.
I'm sending you a pic. So yeah.
All right.
Okay. All right.
Okay.
Thanks everyone.
Bye, everyone. Have a great
Bye.
weekend.